This is Eric Michael Loyd, um, master's student, or I have my master's in clinical psychology, neuropsychology concentration. This is um, the Department of Health and Human Services webpage writing. I know that Nebraska had a spike in their numbers, and the situation is very severe over there. So I wanted to read the Department of Health and Human Services COVID-19 coronavirus general information. What is the coronavirus disease 2019? Coronavirus disease 2019, COVID-19, is a respiratory disease caused by a new virus strain that can spread from person to person. It has the potential to cause severe illness, including pneumonia, in some people. How does the virus spread? COVID-29 is primarily spread from person to person. You can become infected. I think it's supposed to mean 19. COVID-19 is primarily, that might be a typo. COVID-19 is primarily spread from person to person. You can become infected by coming into close contact about 6 feet or 2 arm lengths away from a person who has COVID-19. You can become infected from respiratory droplets when an infected person coughs, sneezes, or talks. Okay? Between people who are in close contact within about 6 feet, or through respiratory droplets produced by an infected person's cough or sneezes. It may be possible for the virus to spread through touching infected surfaces or objects and then touching your own mouth, nose, or possibly eyes. But this is not thought to be the main way the virus spreads. What are the symptoms and severity of illness? Health experts are still learning about the range of the illness caused by the new virus strain. Reported cases have ranged from patients without any symptoms to mild to severe symptoms. Reports show older adults and people with underlying health conditions are more likely to be severely impacted by the COVID-19. Symptoms can appear 2 to 14 days after exposure to the virus. The most common symptoms reported are fever, cough, and shortness of breath or difficulty breathing. Who is at risk for coronavirus disease 2019? Everyone is at risk of getting COVID-19. Older adults and people of any age who have serious underlying medical conditions may be at risk for more severe illness. So sometimes it may not be COVID-19, it could be pneumonia, it could be common flu that ends up being severely detrimental or even life-threatening. How can I protect myself and loved ones from coronavirus disease 2019? There are 10 actions for Nebraskans to be taking now to slow the spread of COVID-19. Stay 6 feet away from others. Stay home and only grocery shop once per week alone. Wear a cloth face covering in public, grocery stores, pharmacies, etc. When you can't stay 6 feet away from others. Work from home. Hold conference calls or virtual meetings instead of in person. Stay home if you or someone in your house has a sudden onset of cough or shortness of breath or a fever. Wash hands often with soap and water. If soap and water aren't available, use an alcohol-based sanitizer. Wash hands before you eat. Cover your nose and mouth with a tissue when you cough or sneeze. Then throw the tissue into the trash. Clean and disinfect frequently touched objects and surfaces, especially counters, handles, doorknobs, tabletops, remotes, and keyboards. Is there treatment for coronavirus disease 2019? Currently, there is not a vaccine or an antiviral medicine to protect against COVID-19. Most people with mild illness will recover on their own by drinking plenty of fluids, resting, and taking pain and fever-reducing medications to relieve symptoms. However, people can develop pneumonia and require medical care or hospitalization. For more information, please visit www.dhhs.ne.gov/coronavirus or www.cdc.gov/COVID-19. That's COVID-19. And that's page 2. At the bottom it says, helping people live better lives. Thank you. I hope this helps.